one hash. Select use points and follow the prompts to use your Central reward.
Everywhere you go, MTN.
Hello there, it's a very good morning to you and that time for Hot on the Hills. I am Isamat Pamela. Doctors under their umbrella body Uganda Medical Association are demanding that the government compensates all health workers who succumbed to COVID-19 while on duty 2 years ago. The leaders of medical practitioners body that remains on strike claim that the bereaved families of the health workers are struggling and choking on poverty since their demise. Dr. Samuel Oledo, the president UMA, says that over 80 health workers, including 50 doctors, have died from the disease in a period of 2 years. He says most health workers in general wards and the OPD departments lack access to adequate personal protective equipment, those are PPEs, and usually interface with the symptomatic patients in their line of duty. Oledo explains that the government has only provided doctors at COVID-19 health facilities with PPEs, leaving out majority in other departments without PPEs, hence their demise.
The government has tried its best to give PPEs in the COVID treatment units in this country, knowing that every doctor or every staff who works in the COVID treatment center is protected. That area is gazetted for COVID positive patients who need specialized care and attention. But you find that many of the health workers, as doctors in the other ward, you find a mother comes in with pregnancy-related complications and actually they are symptomatic. So a doctor has to see these patients. We are using the same gloves, we are using the same masks, even the gloves are not there. So you find yourself touching a patient, so you transfer the infections from a COVID-positive asymptomatic patient to a doctor and his entire family. That's why you see that we've lost over 80 health workers. Over 50 doctors have died due to COVID-related complications, and they acquired COVID in the hospitals. Yet, we've lost no one in the COVID treatment unit. Why? There is protection. They are aware of the patients they're dealing with, and they are given PPEs. Doctors in the general wards, general OPDs, no protection.
That's Dr. Samuel Oledo, President for Uganda Medical Association, UMA. Meanwhile, the Minister of Health, Dr. Jane Ruth Acheng, has more than once insisted that majority of COVID-19 health workers' infections took place within communities. She says they have not registered an infection in COVID-19 treatment wards. Also, the Ministry of Health officials and their counterparts in the Ministry of Gender, Labour and Social Development argue that only doctors who worked on COVID-19 treatment wards and came into contact with non-COVID-19 positive cases deserve compensation since tracing where they were infected. To COVID-19 prioritize the availability of PPEs, including gloves and full body suits and facial masks for all the health workers within the COVID-19 units where they interfaced with patients. According to the Countryman's Workman Compensation Law, families of these health workers are supposed to receive the equivalent of a monthly salary that they were earning of 60 for 60 months after their death. This period can be paid in a lump sum or in a periodic way, and the family members of the deceased doctors who died while at the COVID-19 health units are also entitled to as much as 180 million shillings or even more, depending on the cadre of the deceased. Now, members of the National Unity Platform Party have accused security forces and Kayunga district leaders of acting indiscriminative in campaigns for the Kayunga Lc5 chairperson by-election. The hotly contested by-elections is slated for December 16th, but campaigns end tomorrow, which is Tuesday. The race is tight between Harriet Nakwede, the NUP candidate for the Kayunga Lc5 chairperson by-election, and the NRM's National Unity National Resistance Movement's Andrew Muwonge. The concern from the NUP camp follows a directive by the resident district commissioner Sempala Chikozi to block the party president Robert Kyagulanyi from joining a last campaign rally for their candidate Nakwede. Chikozi had informed the district security committee to stop Nakwede's final campaign rally once she invites Kyagulanyi to hold her final campaign rally in Kayunga Town Council. Now, Nakwede says that such instructions contradict the harmonized campaign program agreed upon by the election Electoral Commission and all candidates. She also says that the decision to allow President Yoweri Museveni to canvass support for the NRM rival Kayunga in Kayunga sub-county and block Kyagulanyi from doing the same for her is a sign of unfairness. Shamin Malende, the Kampala woman member of parliament, who is a special campaigner for Nakwede, says that has described the RDC's directive as a sign of cowardice and low self-esteem.
Have already decided, you see, they are giving us support. So they have already spoken. They are for people power. And we know that they are going to go and protect these votes without even being paid like they did in the general election. So we are sure that the win is going to be ours. It's going to be for Nakwede Harriet and it's going to be for NUP and Robert Kyagulanyi.
President Museveni is also expected in Kayunga to drum up support for the NRM candidate Andrew Muwonge, as well as meet district party leaders and security committee ahead of the by-elections slated for the 16th of this month. Kayunga District Interim Vice Chairperson Joel Kaida has blamed the Electoral Commission for remaining silent as the security committee creates new guidelines contradicting the harmonized campaign program. Meanwhile, more than 47,000 teenage girls in Bukedi sub-region have been impregnated during the 2 years of lockdown. Statistics from the National Population Council indicate that Bukedi registered the highest in an increase of teenage pregnancies from 23,829,000 in 2019 to 25,066 in 2020 and 22,944 in the months between January and October 2021. The statistics also indicate that Tororo and Busia and Palisa have the highest number of teenage pregnancies with 11,480, 7,558 and 7,173 cases respectively. They also follow other districts within the region of Butaleja with 6,955, Budaka with 6,515 and Chibuku with 5,498 pregnancies recorded in just 2 years. Dr. Betty Kadondo, the Director of Family Planning Health at National Population Council, notes that the situation in the region is appalling compared to the national figures. She says that from 2018, the country has been registering over 350,000 cases of teenage pregnancy, noting that this year has been worse, where at least 1 out of every 4 pregnancies is a teenager. Eric Okello, a team leader in one of the affected districts, that's Tororo District Advocacy Teenage Network, says that the country's laws like Penal Code Act and Children's Act do not address the challenges of teenage pregnancy.
Because these laws that we have, if you talk about the Penal Code Act, you talk about the Children's Act, do not address the predisposing factors that perpetuate teenage pregnancies. There are issues to deal with maybe somebody abating or facilitating a child marriage. I can be an LC1 chairperson who sits in a child marriage ceremony. I can also be a religious leader who facilitates a child marriage ceremony. So some of the laws, if you look at the penal code, it punishes the perpetrator. Like, for example, if Eric has defiled a girl, it will punish me. But it won't, for example, punish George, who brings the girl to my house. Or maybe Jane, who calls a friend to be defiled in my house.
That there is Eric Okello, a team leader of Tororo District Youth Advocacy Network. He says that it is time that districts come up with bylaws that will fight the vice, including punishing anyone who perpetrates teenage pregnancy or who promotes teenage pregnancy, and that includes local leaders, parents, friends, among others.
International news.
South Africa's President Cyril Ramaphosa has tested positive for COVID-19 and is being treated for mild symptoms. Ramaphosa started feeling unwell yesterday after leaving the State Memorial Service of South Africa's last apartheid president, F.W. de Klerk, in Cape Town. People who had contact with the president on the day have been advised to watch out for symptoms and get tested. The president is fully vaccinated and has delegated all responsibilities to his deputy president, David Mabuza. And that's how we end this bulletin. I am Pamela. Good morning.
Hot on the Heels. Agagwina War was sponsored by. Get MTN Essential Points when you deposit, send, or withdraw MTN mobile money and use the points